Okay, so for the intradermal, which is going to be my tuberculin, I have the group 3. So for the tuberculin, they want 0.1 milliliters of it. So I already prepared that in my tuberculin syringe. So it's already prepared. I drew it up. So the first thing you want to do is get the prepared medication, take it to the patient's room, and then you're going to want to okay. And then you're going to want to verify the patient using the name, date of birth, compare it to the MAR. And then you're going to want to scan the patient's ID bracelet, perform hand hygiene, don gloves. I didn't bring any, but you would don gloves. And then for this injection site, you want to have a site that is light, that isn't dark, that is like light skin, because you want to assess the patient's reaction to it. So any redness, any irritation, anything like that. So they usually recommend to do the inner part of your forearm or the upper side of your upper back, just so that it's easier for you to notice any visible changes in the skin. Okay, so the next thing you want to do is you find the injection site. I'm gonna have to like that. So you have your skin, you have your this, and then you don't forget your alcohol. And then what you want to do is you're going to apply the swab to the center, and you're going to do it in like a circular motion outward. Okay, and then you're going to allow it to dry, and then hold on, let me see if I can put something behind my camera. Let's see if I can get it to slant. Okay, there we go. Can you see my eyes? Okay, so then you're going to pull it outwards, and you want to make sure that you're going to hold syringe between the thumb of the dominant hand is grasping the dart. So just like that. And the needle is facing up. So you're going to spread the skin with your fingers like this. And you want to make sure that the needle is facing upward, just like that. And since it's intradermal, you want to go to a 5 to 15 degree angle. So I don't know if you can see that. Get right under the skin, just like that. And then want to shit. just like that. And then you want to remove the syringe at the same angle that you insert it. Immediately you would activate the safety using one hand, so I'm just gonna remove it. Just like that. And likewise, I'm gonna go ahead and use the scoop method and prop it back up. And then after that, you would discard of the syringe in a sharps container, and you want to gently pat. So here is, you can see it. There's, so you just want to make sure you can see right there. Okay, and then you just want to pat it gently. Just like that. So then you pat it gently, and then you wouldn't want to massage the area because you're trying to see the effects that it has on that skin with this test. You'd remove your gloves, you would perform hand hygiene, and then you document the administration and the MAR, the medication, the dosage, the route, the site, and the time that you gave the injection. And then you would observe, and then observe to see if the patient has any immediate effects, and then you will tell the patient that, instruct the patient that, and you would have the test would be examined within 48 to 72 hours. So if they note any changes, that's from the TB test. And I think that's